So on behalf of the Red Warriors, I would like to extend my heartiest gratitude to the NSACS team for inviting us in this momentous launching of the City Barn, a pioneering initiative that promises to be a game changer. I am thrilled to learn about this innovative project and its potential to impact lives. As I stand here before you today, I want to emphasize the importance of prioritizing our mental health and well-being. The struggles are real, and addictions can affect anyone. But there's hope. City Barn offers a safe space to seek help, support, and guidance. I encourage all youth of age 24 and below to take full advantage of these services available in multiple locations here in our state: Kohima, Dimapur, Wokha, and Tuensang. So don't suffer in silence. Don't suffer in silence. Come forward and let's break the stigma surrounding mental health. In conclusion, let us embrace City Barn as a beacon of hope and a stepping stone towards a healthier and happier Thailand. Thank you.
Poisonous posts on WhatsApp and the herd mentality of all people who are on this platform. You waste no time in believing something that sounds very dangerous, that sounds very suspicious. So not only advice and counseling, I am sure that City Barn will provide a very interesting platform of social interactions. And like I said, it will be very important for the people managing this facility to start documenting what they have learned, so that the knowledge will gain over a period of many years, interacting with many people who may or may not come again, will be captured and shared and passed on, so that the people who come here in future, or the people who are availing of the facilities elsewhere, can be benefited. So I wish all of you success. This is one of the, it's a shining example of community intervention to preserve and protect the mental, physical, and moral well-being of our young generation, because they are going to own tomorrow. And just imagine if we have a bunch of random young people taking over the reins of our society in 10-15 years from now. What kind of society will we have? So it's not just a medical and mental counseling facility. We need to build up positive values. We need to begin to orient our youngsters to how important and how precious their lives are. Every single one of them. And that is why I keep going back to this educational system. I did study moral science maybe up to class 8. Unfortunately, it wasn't there in metric. But presently, I do not remember any course that is intended to create a very positive and responsible mindset in our young people. It's totally oriented to passing NEET, passing JE, getting a job. And I think as you look around at the scandals, at the paper leaks and all these, you are beginning to see how unscrupulous the system has become today. You have people who are willing to indulge in anything just to succeed in life.
A motley crowd here today, but as I was briefing our chief guest, everyone present here today has a role to play. So we are all, people with a specific assignment and no spectators as such. And this event is, I would say, a small event, but with a specific purpose. And to give you a brief rundown, to walk you through how this came about, I would like to quote that they say, the eyes doesn't see what the mind doesn't know. So to put it in another word, the eyes see what the mind knows. So on that line, our Dr. Bernice from the our Joint Director from the Targeted Intervention Division has seen the need based on our statistics that we receive on a regular basis. So she saw the increasing trend of our young people, especially in the age group of 15 to 24. So among the HRD, which is HRD is high risk group. So she has been seeing this trend, and not just the increasing number of the this category of people, but also in the positivity rate of HIV. So therefore, she conceptualized an idea and initiated in a form of a proposal to NATO. Now this innovation was taken in a very positive note. NATO was positive, very positive about it, and therefore this is how it came about. And from the day one, I've personally seen the kind of zeal, zest on with Dr. Bernice. She had from the minor details to the big issues, she has been working with full of enthusiasm. So today we have this, I would say this is a very happening place today here. So in the days to come, we precisely look forward to that, for this to become a happening place. And what more appropriate kind of phrase to take other than the city barn. City is an acronym for the Catch Them Young. So in our society, what is better than to catch them young, especially at the adolescent stage of their life? So we look forward to this place giving services to the needy, especially in that age group, in the days to come. And with this, I wish this City Barn Center to all the best and in the days to come. And with this, I conclude. Thank you very much.
Thank you for the time, ma'am. The health center and innovative project by the NSACS connecting with the young people below the age of 24, concerned about their health, well-being. So, what was the main objective behind, launching of this health center by the department? Can you a little bit elaborate more on this project?
Okay, thank you NLTV for joining us. We are this actually the City Barn. We call it the City Barn. Catch them young, be aware, reach on time, and no to unsafe behavior. This idea came about considering that from our program informations, we are getting the vulnerabilities have been increasing amongst young people. And since under NSACS we also focuses on HIV, we also see a lot of young people getting the infection. So we thought that we'll start a center which is not just regular conventional center. This is an innovation project which has been approved for the state of Nagaland only, as this proposal has come up from our state itself. So we had the idea is to get all young people below 24 who feels that they are a little worried about their own health and well-being. So this will be an enabling space where any young people who feels that they have worries about their health can drop in and get informations requiring their in regard to their health and well-being. So we encourage all young people not to worry about the fear of getting your identity disclosed. We'll keep everything confidential. Our team here, they are all experts in the counseling sectors, and we will the objective is to make sure that we provide this comprehensive information center including some counselings, and for those who may require advanced counselings, we refer them to the respective specialized counselors also. And that's how we are starting this. We are starting this project in Kohima, Dimapur, Wokha and Tuensang as a pilot. So we are looking forward that this project should also give us an idea of how to reach out to the vulnerable before they get into the high risk behaviors, or before they get into vulnerable behaviors, and or before they get an infection like HIV, or before they get into depressions on mental health, before they get into dependency, high dependency and addiction, or maybe sexual reproductive health risk. So this center is we are looking forward to have a comprehensive kind of an information package center where all young people should feel free. The timing is according to the need of the young people. Will be open from 11 to 5 o'clock as of now, and based on need we'll be moving around the timing. We consider the timing based on the school and college timings as well, and we had also encouraged the participations of the schools and the Red Ribbon Clubs today also with us, so that they are able to refer their students and young people who might be concerned about their health, and the teachers are concerned about them. So this is kind of an information center with a counseling facility in place.
So, ma'am, what are the facilities that has to be provided to the young people through this health center?
Yeah, the facility basically will start with counseling facility, also free counseling services. We also have anonymous question and answer section where young people, if they don't want to be identified, they don't want to talk about it, they can paste their queries in a query board, and then the counselors here will respond it by pasting back the answers to the query boards. And we will also have a help desk where the coordinators, the counselors will be on spot here to facilitate any kind of health information that they would require. And then along with the counseling packages, referral is one of our major, going to be our strength, because we are linking up with all the specialized counselors, and then we'll be linking them, especially those young people who would require advanced counseling services. We'll link them up to those services that is available around the town. And we are also looking at, involving, the clubs, the Red Ribbon Clubs, we have it in colleges. We also have higher secondaries with Red Ribbon Clubs. We have the, NYKs, out of school youths, Bharat Scouts and Guides. So we collaborate with everyone so that this becomes a referral point for all of them also, in case if they come across young people who are in need of counseling support.
Ma'am, what will be your message out to the young people who are in need of this counseling through this health center?
Yeah, this center has been opened for you. It is by the young people, for the young people, and with the young people. So please don't hesitate to be here. The counselors present here are also young people, like just one of you. So please feel free, drop in anytime, so that you are able to share your problems if you have any, or just hang out, come and share your concerns with your peers who could be having similar problems and dropping into the center. Please feel free to drop in. The informations regarding your identity will be kept fully confidential, like the way we maintain in other programs. So please don't hesitate to approach us. Parents may also approach if there's any need for the services required for their own children. So this is open for all young children below 24 who has some concern about their health and well-being.
Nagaland TV, Sob Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.